Hi, this is Dr. Victor, again bringing you interesting highlights from ESC Heart Failure 2021 Congress. Next topic is efficacy and safety of antithrombotic strategies in patients with atrial fibrillation and recent ACS or PCI with and without a history of heart failure. Insights from the Augustus trial. The Augustus trial was done in atrial fibrillation patients with recent ACS or PCI and Apixaban on background of P2Y12 therapy without aspirin resulted in less bleeding, few hospitalization and no significant difference in ischemic events compared to regimen that included vitamin K antagonist, aspirin or both. Heart failure is frequent in this population due to prothrombotic state and associated with high mortality and morbidity. In this study, they evaluated the safety and efficacy of two different antithrombotic regimens in patients with or without heart failure, irrespective of ejection fraction. In 4,614 patients with background of P2Y12 therapy were randomized to either Apixaban or Vitamin K Antagonist regimen, and each group was re-randomized to aspirin or placebo. At end of 6 months, the results showed that the patient group with heart failure had higher cardiovascular death and all-cause death events compared to group without heart failure, while risk of major bleeding, all-cause death or rehospitalization or all-cause death with ischemic events remained fairly same between the group. Comparison between Apixaban and vitamin K antagonist therapy in patients with heart failure showed no significant difference in terms of major bleeding, all-cause mortality, or rehospitalization or all-cause death or ischemic events. Similarly, aspirin therapy in patients with heart failure increased major bleeding events but remained statistically non-significant like rest of the adverse event. Thus, the study concluded that a history of heart failure is common in patients with atrial fibrillation and in recent ACS or PCI and associated with increased risk of all-cause and CV mortality. Irrespective of history of heart failure, treatment with P2Y12 and antithrombotic regimen that included Apixaban without aspirin resulted in less major or clinically relevant non-major bleeding and fewer death and hospitalization than regimen that included vitamin K antagonist, aspirin or both. Thank you.